Being stabbed by a knife can be a terrifying and life-threatening experience. It's important to remember that if you or someone you know has been stabbed, you should call 999 or your local emergency number immediately. While waiting for medical help to arrive, there are a few first aid steps you can take to help the victim. First, make sure you are safe and keep checking the area to make sure there's nothing that may be a danger to you. Try and assess the severity of the injury. If the wound is bleeding heavily, you'll need to try and stop the bleeding. To do this, apply firm direct pressure to the wound using a clean cloth or gauze. If the victim has a knife stuck in the wound, do not try to remove it. Removing the knife can cause even more damage to the surrounding tissues and blood vessels. Instead, try to stabilize the knife and prevent it from moving by placing a cloth or a gauze around the handle. On a limb, you may need to apply a tourniquet to stop the bleeding. We cover tourniquets in other videos. Once the bleeding has been controlled, try to keep the victim as still as possible. Moving the victim can cause further damage to the wound and increase the risk of bleeding. If the victim is in a lot of pain, try and keep them as comfortable as possible by helping them to find a comfortable position and providing emotional support. While waiting for medical help to arrive, it's important to keep a close eye on the victim's vital signs, such as their pulse, breathing, and level of consciousness. If the victim's pulse becomes weak or they stop breathing, you may need to begin CPR, cardiopulmonary resuscitation. CPR involves applying chest compressions and rescue breaths to the victim in an effort to maintain blood flow to the brain and other vital organs. In summary, being stabbed by a knife can be a life-threatening injury. If you or someone you know has been stabbed, it's important to call for help immediately and follow these steps to help the victim. Remember, the most important thing is to keep the victim as still as possible and try and control the bleeding. If the victim's vital signs become unstable, you may need to begin CPR.